Welcome to the weekly dose of self-care, presented by your neighborhood pharmacist. Today, we're going to talk about improving your bone health on your own. Why is bone health such an important thing? That's because it's considered as a silent killer, because there's generally no symptoms even if you have a spine fracture. The one active way to monitor if you do have a spine fracture is looking at your height. So if you regularly monitor your height, if there is a change of greater than 2 centimeters shorter, then that might be an indication of a spine fracture. But if you don't measure it often, then you can compare your current height versus the height when you were a young adult. If there's a difference of greater than 6 centimeters, then you might have a fracture. The way to know if your bone health is healthy or not is by doing a bone density test. So essentially it's kind of like an X-ray. And after they do that, they will give you something called a T-score. The other thing that you want to know is something called standard deviation. If you're greater than 2.5 times the standard deviation, then you have something called osteoporosis. If it's between 1 to 2.5, you have something called osteopenia. To help you understand what the difference between osteoporosis and osteopenia is, let's look at the pictures. So on the very far left, it is a picture of a healthy bone. You see everything is compact and healthy. The middle part is osteopenia. You can see that there is still quite a lot of bone, but there are quite more holes in it. The last one on the right is osteoporosis, where you can see that if you squeeze it, you feel like it's going to just break apart. So we need our bones to be healthy and strong to withstand any impact. In terms of who should get a bone density test, the ones at higher risk are women and men greater than 65 years old, or they had some history of prior fracture, either they smoke or drink a lot, and other potential factors. The daily calcium requirement, including your diet and supplements, will depend on your age. If you're between 19 to 50 years old, then it's recommended to get 1000 milligrams of calcium. But if you're 50 plus, then you gotta take 1200 milligrams. When you hear calcium, you also hear vitamin D. The reason why it's used in combination is because that calcium is like a nutrient that our bones need to make itself stronger. So it's like a building block. While vitamin D is there to make our body absorb calcium better, so now there's even more building blocks. Some common sources of calcium come from yogurt, milk, and cheese. You can see the proportion as well as how much calcium you will get. You might say, I'm lactose intolerant. Then what do? Where do I get my calcium? One thing you can do is try to buy something called Lactaid that's over the counter. And this is there to replace the enzymes that the body doesn't have to break down dairy products. The other obvious choice is to drink soybean milk or other dairy products that is not exactly dairy but it still has calcium. The other choice is to take a calcium supplement. When you look at calcium, it's very important that we look at the elemental calcium. Elemental calcium is the calcium that our body can use and absorb. The supplements come either as a calcium tablet on its own or in a combination with vitamin D. So for those who don't like taking pills, usually a combination in one is probably the most convenient. In terms of how many tablets to take, it depends on your diet intake of calcium. As long as it adds to your target per day, then you are fine. Vitamin D is also called a sunshine vitamin, just because when the sun shines on your skin, your body will automatically produce vitamin D. Typically, if you get some sunshine on your arms and face for 10 to 15 minutes, 2 to 3 times per week, usually that's enough. But sometimes when you wear clothes or sunscreen, it might decrease the amount of vitamin D that's produced by your body. And that's when you might need to take some vitamin D supplements. So the dosage wise varies from 400 IU to 1000 IU. Typically, the recommendation is just to do 1000 IU, 1 tablet once per day, unless specified by your doctor. For those who have issues swallowing tablets, there are chewable forms, such as this chewable vitamin D, or they're actually more like soft candies, like the Caltrate over here.